Hear from Governor Charlie Baker about a new effort here in Massachusetts to help people affected by the coronavirus. He's at Eastern Bank today. Let's listen in.
COVID-19. There are 100 ventilators that we received from the national stockpile, and those are being sent out to community hospitals and academic medical centers starting today. The distribution will be based on guidance that the command center got from its medical advisory group, and in this particular case that was led by Paul Bittinger from Mass General. Based on today's testing results, we've now tested about 76,500 people in Massachusetts, and 13,837 have tested positive. Tomorrow we'll announce a new site in Lowell in partnership with CVS that will conduct up to 1,000 tests a day. That will be done probably on an appointment basis, and we'll work through a variety of communities such as first responders and others in public safety who we've tried to make these drive-through test sites available to in other parts of Massachusetts. There's another one that will be going up probably later this week at the Big E in West Springfield. Obviously, without question, this public health crisis continues to be one of the most challenging events we in the Commonwealth have ever faced. And I want you to know that I spoke many times yesterday with Boston Mayor Marty Walsh about everything he's doing to slow the spread of COVID-19 in Boston. I believe he's doing a terrific job. We spend a lot of time talking to each other. Many people who work on his staff spend a lot of time talking to people working on my staff, and we fully support the initiatives and the policies that he is pursuing for the city of Boston. I think in many respects the overarching message that comes from many of the announcements that he made yesterday is a really simple one. If you don't have to leave home, don't. If you need to go to the store, if you need to shop at the supermarket, one person should be able to make that trip. If you need to go for a walk, by all means, go for a walk. But we're not supposed to be gathering in groups. That's been made very clear now for several weeks here in the Commonwealth of Massachusetts. We are not supposed to be playing active outdoor sports with each other. And many of the initiatives that have been pursued by many of my colleagues in local government have been in direct response to the small portion of people in their community who aren't following the guidelines that everybody else seems to have been able to adopt. And this is especially true now more than ever as we head into what we all believe is going to be a particularly difficult period for many of our healthcare providers and many of our constituents. And I can't express how important it is that people take this stuff seriously and take it to heart. I talked several weeks ago about the purpose that's associated with all this. Many people had talked to me about the fact that as they no longer could go here or go there or do this or do that, they felt they had lost a significant part of their purpose. And what I would say to all those people is something I've said before, that there is tremendous purpose in all the issues associated with social distancing, and all the issues associated with hygiene, and all the issues associated with disinfecting and wiping down surfaces. Because with a virus like this one, that's as contagious as this one, and in many cases as invisible as this one can be, the most important and purposeful thing we can all do is abide by those rules and engage them in a serious way.